Hello, I'm Prasanna Basnet, and today we'll be talking about COPD exacerbation management for Mr. David Nazzal. So the information I got from the A2E vital signs assessment on David Nazzal are as follows. Airway. David's airway is patent and he's maintaining his own breathing. Breathing. David's breathing assessment reveals critical symptoms of exacerbation of COPD. David's respiratory rate is 30 BPM and his oxygen saturation SpO2 is 78% on room A, which is critically below the recommended range of 88 to 92% for people with COPD. The low percentage of oxygen in his blood points towards acute hypoxemia. His arterial blood gas levels also show an increased partial pressure of carbon dioxide (PaCO2) at 60 mmHg, which indicates hypercapnia and respiratory acidosis. Circulation. The circulation assessment on David revealed critical concerns that needs immediate attention. His heart rate is also increased to 128 beats per minute, tachycardia, which could be a response to hypoxemia and respiratory distress. His blood pressure is also can be seen the higher side, which is 168 by 85 mmHg. This might also be a reaction to anxiety or hypoxemia. His capillary refill time is also more than 2 seconds, and his extremities are cold, suggesting poor peripheral perfusion. Disability. Doing a disability assessment in David, which indicates his Glasgow Coma Scale GCS of 14 by 15 with minor confusion and distress. This is most likely the result of both hypoxemia and hypercapnia. His GCS could be worse if his respiratory condition deteriorates, which emphasizes continuous assessment to detect early signs of respiratory failure. Exposure. When evaluating the exposure assessment for Mr. David Nazzal, who is going through a COPD exacerbation, it is important to consider the environmental factors and possible infections causing his condition. His fever increased sputum production with purulent yellow film and raised C-reactive protein (CRP) of 25 mg per liter points towards underlying infection, most likely bacterial infection, as he has an exacerbation of COPD. In conclusion, A2E vital signs assessment on David Nazzal gave us critical information about his condition. David's airway remains patent, but his respiratory rate is elevated with critically low oxygen saturation. This vital signs assessment also revealed hypertension and tachycardia, which could be a response to hypoxemia. His GCS of 14 by 15 points towards possible neurological impairment, which makes close monitoring essential for him. His fever, increased sputum production, and CRP also indicate towards possible bacterial infection, making his condition worse. Therefore, continuous assessment is crucial for further information on David's condition. The list of 4 high-priority nursing interventions with rationale for managing Mr. David Nazzal's exacerbation are as follows. Breathing techniques. Breathing techniques like pursed lip and diaphragmatic breathing are important therapies for controlling COPD exacerbation in David. These breathing techniques will help to increase alveolar perfusion by correcting the abnormal breathing patterns what the patient has been used to, which will eventually improve breathing efficiency and will relieve dyspnea. Pursed lip breathing technique helps to eliminate the feeling of running out of breath by extending the exhale, hence releasing the trapped air in the lungs. Similarly, diaphragmatic breathing encourages deeper breaths, which will maximize oxygen supply in the body. Smoking cessations. Maintaining smoking cessations is an important strategy in management of COPD exacerbation, as it helps to tackle the major cause of the COPD progression. It has been found that quitting smoking has a lot of benefits. It also helps to decrease COPD progression, which is mainly caused by lung damage. Although the greatest advantages comes from total cessations, still cutting back on cigarettes and being aware of the side effects of cigarettes can still have a positive impact. Patient education. Patient education is important for managing David's exacerbation of COPD as it gives him knowledge so that he can make informed decisions about his health. David's condition could greatly improve by educating him about the causes and treatments of COPD like smoking cessations, proper use of inhalers, medication adherence, and lifestyle changes. Nutritional support. Eating habits plays an important role in the outcome of COPD. Proper nutritional management and supplementation are crucial to control Mr. David's exacerbation. Patients with COPD are usually seen with low fat-free mass. muscular atrophy, and unintentional weight loss. All of these could play a part in exacerbating the symptoms further. A diet with proper nutrition can help in lowering the incidences of exacerbation, improving respiratory health, preserving muscle mass, and enhancing overall quality of life. Oxygen therapy. Monitoring Mr. Nuzzle's oxygen saturation levels and trying to get it to 88 to 92% while also looking for any signs of respiratory distress, changes in mental status, and baseline carbon dioxide levels to adjust therapy if needed. Administration. Supplemental oxygen should be administered using appropriate devices while following the prescribed guidelines. Oxygen needs should be reassessed frequently, particularly after any changes in his condition. Side effects such as respiratory depression and hypocapnia. Also keeping an eye out for any indications of disorientation or fluctuations in vital signs that might be pointing to deteriorating condition. Salbutamol Ventolin. Monitoring respiratory status, including respiratory rate, oxygen saturation, and breath sounds before and after administration to evaluate the effectiveness of medication. Administration. Ventolin inhaler is only to be administered through the inhalational route, which is to be breathed in through the mouth. It is recommended to use it every 4 hours with 1 or 2 every inhalations. Every Ventolin inhalation has a bronchodilator effect that lasts for at least 4 hours, so repetitive use shouldn't be necessary. Side effects. Some patients may experience tension, tachycardia, and a compensatory increase in cardiac output due to peripheral vasodilation. Cardiac arrhythmias can also happen, including supraventricular tachycardia or atrial fibrillation. Warm feelings, headaches, nausea, and palpitations are a few other typical adverse effects. Iptropium atropine assessment, monitoring Mr. Nuzzle's respiratory status and assessing for potential contraindications such as narrow-angle glaucoma or urinary outflow obstruction. Administration. It is recommended 2 to 3 times a day. A dose of 44 to 88 micrograms should be administered into each nostril. This is the same as 2 to 4 atropine nasal sprays or 1 to 2 atropine nasal forte sprays, 2 to 3 times a day into each nostril. Side effects. Keeping a close eye out for adverse reactions including dry mouth, sore throat, lightheadedness, and retention of urine. Also monitoring for uncommon but potential fatal side effects like anaphylaxis or bronchospasms. Prednisolone assessment, monitoring Mr. Nuzzle's fluid balance, blood pressure, and renal function, as prednisolone can cause fluid retention, hypertension, and renal impairment. Also, assessment for any signs of infection, since corticosteroids can mask infection symptoms. Administration. The initial adult dose may range from 20 to 40 mg daily, but can be increased to 60 to 80 mg daily if necessary. The maintenance dose can usually be 5 to 20 mg daily in long-term therapy, and the ideal dose should not be greater than 40 mg per day. Side effects such as gastrointestinal tract infection, electrolyte abnormalities, mood swings, decreased wound healing, osteoporosis, and heightened vulnerability to infections. Also keeping an eye out for symptoms of adrenal suppression or Cushing syndrome. Azithromycin, Zithromax. Evaluating Mr. Nazzal for any allergies to macrolides, asking about the history of cardiac issues, QT prolongation, and any signs of superinfection. Monitoring for liver function tests and assessing for signs of gastrointestinal upset or allergic reaction. Administration. Azithromycin 200 mg by 4 ml, 40 mg per ml is present in each bottles. For the 600 mg presentation, add 9 ml of water. Shake well to produce 15 ml of suspension. Side effects includes GI upset, rash, and signs of hepatotoxicity. Watch for serious adverse reactions such as arrhythmias, dizziness, or severe allergic reaction, and report any significant findings promptly. Neonatal and ritonavir. Assessment. Assessing Mr. Nazzal's renal function, EGFR, liver function tests, LFTs, and current medication list to identify potential drug interactions, especially with CYP3A substrates before administering Paxlovid. Also assessing for symptoms of COVID-19 progression and any adverse reactions. Administration. The recommended doses is 300 mg nirmatrelvir, 150 mg tablets with 100 mg ritonavir 100 mg tablet taken together orally every 12 hours for 5 days. Side effects: dysgeusia, hypertension, malaise, headache, liver function abnormalities, and allergic reactions. Provide education on potential side effects and advise Mr. Nazzal to seek immediate medical attention if he experiences severe adverse effects. So these are the references that I've used. And thank you. That's the end of my presentation.